For months, 62-year-old Robert Bennett suffered from mysterious itchy welts that appeared on his skin each morning. What he dismissed as simple bed bugs led him down a nightmare path no one could have predicted despite professional exterminators, dermatologists, and countless sleepless nights. The truth remained hidden beneath his skin. Literally, when renowned parasitologist Dr. David Murray finally examined the samples under his microscope, his reaction would change everything. "I've never seen this in Ohio," he gasped, backing away from his equipment. "This is impossible." What Dr. Murray discovered lurking beneath Robert's skin wasn't bed bugs at all, but something far more horrifying. Living parasites typically found only in dogs' hearts, now migrating through a human's body. Stay with us as we uncover the shocking truth behind Robert Bennett's mysterious condition and the fight to save a man from an invisible enemy that had made his body its home. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. Robert Bennett stood in front of his bathroom mirror examining the cluster of angry red welts along his forearm. The morning sunlight streaming through the small window illuminated each raised bump on his pale skin. He winced as he ran his fingertips over them, each touch sending a wave of itching that threatened to drive him mad. This marked the 5th consecutive morning he'd woken to find new bites. He reached for the calamine lotion on the countertop, applying it generously to the inflamed areas. The cool sensation provided momentary relief, but Robert knew from experience that the rest bite would be brief soon. The itching would return with a vengeance. "Damned bed bugs," he muttered, screwing the cap back onto the bottle. "Thought I'd gotten rid of you all at 62. Robert had expected retirement to bring peaceful mornings with coffee on his porch, not this daily horror show. After 38 years sorting mail at the Mapleton post office, he'd earned his rest instead. For the past 3 weeks, he'd been locked in battle with an unseen enemy. After applying the lotion, he shuffled to the kitchen, his slippers dragging across the worn linoleum floor. The house felt particularly quiet this morning, emphasizing how alone he was in dealing with this problem. Since Margaret's passing 2 years ago, the silence had become both a comfort and a curse. Robert filled the kettle and placed it on the burr stove, then reached for his phone. He joined Joe, a community Facebook group where residents of Mapleton shared local news and recommendations. Yesterday he'd posted asking for exterminator suggestions, and several neighbors had responded as the kettle began to whistle. He scrolled through the comments. Frank Martinez from 2 streets over had recommended Ohio Pest Solutions, claiming they'd eliminated his ant problem last summer. 3 others seconded the recommendation. Robert jotted down the number, determined to make the call after breakfast. The morning passed slowly as Robert went through his routine. He ate his oatmeal methodically, took his heart medication, and read the newspaper. All the while, the itching persisted, forcing him to stop every few minutes to scratch, despite knowing it would only make things worse. By 11, he made the call to Ohio Pest Solutions and scheduled an appointment for the following day. The receptionist had assured him their technicians were experienced with bedbug infestations and suggested he begin washing all his bedding in hot water ahead of you. "There," Robert had replied. "Done it twice already this week." The remainder of the day dragged as Robert tried to distract himself from the constant irritation. He vacuumed every inch of his bedroom, focusing particularly on the mattress seams and the area beneath the bed. He bagged up his pillows and placed them in the dryer on high heat, remembering something he'd read online about the temperature killing the insects. As evening approached, his sister Rita called their daily check in a ritual neither wanted to eyebrow. "How are you holding up?" Bobby Rita's voice came through the speaker, warm and familiar, same as yesterday. "Right, still itching like crazy. Got an exterminator coming tomorrow. Good, you know. Mrs. Holloway down the street had bed bugs last year, said it was a nightmare getting rid of them." Robert sighed heavily. "That's reassuring." "Sorry," Rita backpedaled. "I just meant it's common. Nothing to be embarrassed about. You're not living in filth or anything." I know, just frustrated is all. Can't sleep, can't focus. These things are driving me up the wall. Want me to come over? I could help you clean." "No need. Everything's ready for the exterminator. Besides, don't want you getting bit too." Their conversation continued for another 20 minutes before Rita had to go prepare dinner for her husband. After hanging up, Robert stood in his kitchen, the silence enveloping him once more that night. Like the previous ones, sleep proved elusive. Robert lay in bed, every slight sensation on his skin causing him to jolt awake, convinced the bugs were crawling on him. He changed the sheets again before bedtime, inspecting each inch of the mattress with a flashlight, but found no evidence of the insects. "Where are you?" Hiding, he whispered into the darkness, frustration building. The alarm clock's red digits marked the slow passage of time: 11:42, 12:15, 1:37. By the time morning arrived, Robert had managed perhaps 3 hours of fragmented sleep. He rose feeling worse than. When he'd gone to bed, the mirror revealed what he already knew. Several fresh bites had appeared overnight, this time on his upper back and neck. Reaching around awkwardly with the calamine lotion, he attempted to treat the areas he could reach. Jake Collins from Ohio. Pest Solutions arrived promptly at 9, his van pulling into Robert's driveway with the company logo emblazoned on its side. He was younger than Robert expected, perhaps mid-30s, but his manner was professional as he introduced himself. "Mr. Bennett, I'm Jake. Heard you've got some unwelcome guests." Robert nodded, ushering him inside. "Been dealing with them for weeks now, can't seem to get rid of them, no matter what I try." Jake sat down his equipment case in the hallway and pulled out a clipboard. "Tell me what you've been experiencing exactly." "Wake up every morning with new bites," Robert explained, rolling up his sleeve to feel the welts on his arm. "They itch like hell. I've washed everything. Vacuumed, sprayed, store-bought. Insecticide, nothing works." Jake examined Robert's arm with a practiced eye. "And you're only noticing new bites in the morning, not during the day?" "That's right. Only after I've been sleeping. Classic bedbug behavior." Jake nodded. "Their nocturnal feed. While you're asleep, mind if I inspect your bedroom?" Robert led him upstairs to the small bedroom where the floral wallpaper Margaret had chosen 20 years ago still adorned the walls. Jake donned gloves and began a methodical examination, starting with the bed. He stripped the sheets, inspected the mattress seams with a flashlight, checked the headboard, and looked behind picture frames. After 30 minutes of thorough searching, Jake's expression had shifted from confident to puzzled. He moved to the dresser, checking behind it and underneath each drawer, finding anything. Robert asked anxiously. Jake straightened up, perplexed. "That's just it, Mr. Bennett. I'm not finding any evidence of bedbugs, no casings, no feel spots, no bugs themselves. But what about the bites?" Robert gestured to his arms and neck. "I'm not disputing you're being bitten by something," Jake replied, continuing his search around the baseboards. "But bedbugs leave signs: mold skins, blood stains on sheets, dark feel spots. I'm not seeing any of that here." Robert felt a wave of frustration. "So what's causing this?" Jake spent another hour checking the entire house, paying special attention to the living room sofa, other furniture, and even the basement. When he finally packed up his equipment, his conclusion remained unchanged. "Mr. Bennett, I can't in good a conscience treat your home for bedbugs when I can't find any evidence they're here. Those bites could be from something else. Carpet beetles, mites, even an allergic reaction to something. So you're saying..." "I'm imagining this." Robert's voice rose slightly. "Not at all." Jake assured him those bites are real, but treating for the wrong pest won't solve your problem. "I'd recommend seeing a doctor. If it is some kind of insect, they might be able to identify it from the bite pattern." Robert walked Jake to the door, his mind racing. If not bedbugs, then what? The prospect of more nights of interrupted sleep and mysterious new bites each morning filled him with dread. "I can recommend a dermatologist," Jake offered, sensing Robert's distress. "My wife saw Dr. Sharma last year for a rash. He's supposed to be one of the best in the county." Robert jotted down the name, thanked Jake for his time, and closed the D behind him. Standing in his empty hallway, the itching seemingly intensified, as if to mock him. Whatever was causing this wasn't going to be an easy fix that afternoon. Robert called Dr. Sharma's office and was surprised to get an appointment for the following week. A cancellation had opened a slot. The receptionist sounded concerned when he described his symptoms and mentioned the fruitless exterminator visit for the next 5 days. Rob's condition worsened. The bites continued to appear each morning, and the itching became so severe that he began taking over-the-counter antihistamines just to function. He tried sleeping on the couch one night, only to wake with bites along his C. Whatever was attacking him had free reign of the house by the time his appointment arrived. Robert was desperate. The waiting room at Mapleton Medical Plaza felt unnecessarily right, the fluorescent lights highlighting every mark on his increasingly irritated skin. Other patients cast curious glances his way as he scratched absently at his wrist. Robert Bennett, a nurse, called his name. Leading him to an examination room, Dr. Sharma entered. Moments later, a slender man with kind eyes and a precise manner. He introduced himself with a firm handshake, then immediately focused on Robert's visible bites. "How long has this been happening?" he asked, examining Robert's arms. "Almost a month now. Started with just a few bites now. They're everywhere. Exterminator says it's not bed bugs." Dr. Sharma nodded thoughtfully, making notes on his tablet, "And they only appear after you've been sleeping." "Yes, always in the morning, new ones every day." The examination continued as Dr. Sharma checked Robert's entire body. Documenting the pattern and appearance of the bites, he took several photographs and asked detailed questions about Robert's daily routine, recent travels, and any new products he might be using. "I'm going to take a small skin sample," Dr. Schur explained, preparing a sterile instrument. "It won't hurt much, just a quick scrape from one of these more recent welts." Robert winced slightly as the doctor collected the sample, placing it carefully in a labeled container. "What do you think it is?" Doc Robert asked, as Dr. Shammer removed his gloves. "I'm not jumping to conclusions yet," the dermatologist replied. "Oh," cautiously, "these could be insect bites. But the pattern is unusual for common household pests. Could also be a contact dermatitis or allergic reaction. The sample will help rule some things out." Before leaving, Dr. Sharma prescribed a stronger antihistamine and a topical corticosteroid cream. "This should help with the itching while we determine the cause. I'd like to see you again in 1 week, but call immediately if you develop any via swelling beyond these welts or if the bites start to look infected." Robert left the appointment feeling slightly more hopeful. The new medication might provide relief, and at least someone was taking his problem seriously. Still, as he drove home, the mystery remained. If not bed bugs, then what creature had chosen him as its midnight feast? Telling and preparing this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us now. Back to the story. The steroid cream Dr. Sharma prescribed provided Robert with his first real relief in weeks. The angry red wells no longer itched quite so ferociously, allowing him a few hours of uninterrupted sleep. Still, each morning brought the unwelcome discovery of fresh bites, usually in new locations. His lower back one day, behind his ears the next, then across his shoulders. Whatever was causing this was mobile and relentless. On the third night after his dermatologist appointment, Robert decided to try something different. He set up his old digital camera on the dresser opposite his bed, pointing it toward where he slept. He'd read online about people catching bed bugs in action this way, though Jake the exterminator had found no evidence. Robert wasn't convinced. Maybe these bugs were unusually stealthy. "Let's see if I can catch you in the ACT," he muttered, setting the camera to record throughout the night. Morning arrived with the now familiar sensation of itching, this time along his collarbone. Robert immediately checked the camera, rewinding throughout of footage, showing nothing but himself tossing and turning in the darkness around 3:17 a.m. He paused, noticing something unusual. The blanket over his leg moved slightly, though his leg remained still. He replayed the section several times, trying to determine if his eyes were deceiving him. There was definitely movement, a subtle rippling beneath the covers, but no visible insect. Robert felt a chill run down his spine. Something had been there, moving across his body while he slept. His phone rang, startling him. It was Dr. Sharma's office. "Mr. Bennett, this is Nurse Patel from Dr. Sharma's office. The doctor would like you to come in today if possible. He's received some results from your skin sample. Today is something wrong." Robert's pulse quickened. "Dr. Sharma prefers to discuss results in person. We have an opening at 1:30 this afternoon." Robert agreed, his mind racing. Doctors didn't rush appointments for good news, did they? He arrived at the medical plaza 20 minutes early, his nerves getting the better of him. The waiting room seemed more crowded than before, and an elderly woman across from him kept staring at the visible welts on his neck. Self-consciously, he turned up his collar. This time, Dr. Sharma didn't keep him waiting. Nurse Patel led Robert directly to an examination room where the dermatologist was already reviewing notes on his computer. "Mr. Bennett, thank you for coming in on such short notice." Dr. Sharma's expression was unreadable as he gestured for Robert to take a seat. "How are the medications working?" "The cream helps with the itching, but I'm still getting new bites every morning." Dr. Sharma nodded thoughtfully. "I've received the preliminary analysis of your skin sample, and there's something unusual I wanted to discuss with you right away." Robert straightened in his chair. Unusual. How the lab found microscopic evidence of something in the tissue that shouldn't be there. Dr. Sharma turned his computer screen, showing an image that meant nothing to Robert. Just blurry shapes and colors. Do you see this darker area here? The lab. Technicians believe this might be evidence of a parasite. Not insect bites as we initially thought a parasite. Robert repeated the word, sounding ominous like a worm or something. Potentially. Yes, this is outside my immediate expertise. Which is why I'd like to refer you to an infectious disease specialist, Dr. Lydia Okafor at Cleveland Medical Center. Is excellent. I've already spoken with her about your case, and she's agreed to see you tour tomorrow morning. Robert's mouth went dry tomorrow. That fast, I believe we should move quickly, Mr. Bennett. While there's no immediate danger if there is a parasitic infection, early intervention is important. The weight of Dr. Sharma's words settled heavily on Robert's shoulders. He'd come in expecting to hear about an unusual allergic reaction or rare insect bite instead. He was facing something that sounded far worse. These parasites, are they contagious? Should I be worried about my sister? She visits regularly. Dr. Sharma shook his head. Based on the presentation, this doesn't appear to be easily transmissible from person to person. But I prefer Dr. Okafor to make that determination. She's the expert. Robert left the office with a referral document and a growing sense of RE in his car. He called Rita to cancel their weekly dinner plans, providing only vague details about needing additional medical tests. He didn't want to worry her unnecessarily, but the thought of potentially harboring parasites made him reluctant to be around anyone. Until he knew more that evening, Robert found himself doing something he'd promised Margaret he wouldn't do. Searching his symptoms online, each website led him down increasing disturbing rabbit holes from tropical parasites contracted through contaminated food to worms that could migrate through human tissue by midnight. His anxiety had reached new heights, and he found himself checking his body obsessively for any new marks or sensations. Sleep, when it finally came, was fitful and filled with nightmares of things crawling beneath his skin. Cleveland Medical Center loomed large against the morning sky, its modern glass exterior reflecting the clouds above. Robert felt small as he entered the sprawling complex, following directions to the infectious disease department on the 4th floor. Unlike Dr. Sharma's warm, intimate office, this waiting area felt clinical and impersonal. Other patients kept their distance, some wearing masks, making Robert wonder if they thought he might be contagious. A digital display called his name after just 10 minutes, directing him to consultation room 4B. Dr. Lydia Okafor wasn't what Robert had expected. She was younger than him by at least 20 years, with a confident presence and alert eyes. That seemed to catalog every detail about him within seconds of their meeting. Mr. Bennett, I'm Dr. Okafor. Dr. Sharma sent over your files. I understand you've been experiencing unexplained skin reactions for several weeks now. Her voice carried a slight accent that Robert couldn't place, but her manner was direct and reassuring. That's right, started thinking it was bed bugs, but the exterminator couldn't find any evidence. Then Dr. Sharma mentioned possible parasites. Dr. Okafor nodded, reviewing the notes on her tablet. I've looked at the images from your skin sample. They're inconclusive, but concerning enough to warrant further investigation. I'd like to perform a more extensive examination today and run some blood tests with your permission. I'd also like to take additional tissue samples. The examination that followed was the most thorough Robert had ever experienced. Dr. Okafor inspected every inch of his skin, paying particular attention to the areas around the bites. She took measurements of the welts, photographed their pattern, and used a specialized magnifying device to examine the skin's surface. These don't present like typical insect bites, she commented, focusing on a cluster near his shoulder blade. The inflammation pattern is different, more like a reaction to something moving beneath the skin rather than a puncture from outside. The phrase "moving beneath the skin" sent a wave of nausea through Robert. You think something's inside me? Dr. Okafor straightened up, her expression professionally neutral. I don't want to alarm you unnecessarily, Mr. Bennett, but yes, that's one possibility we need to consider. There are several parasitic organisms that can infect subcutaneous tissue, the layer just beneath the skin. She proceeded to draw blood samples and performed a procedure to extract small tissue cores from 2 Locations, one near a fresh welt and another from a healing bite. Though the local anesthetic prevented pain, the knowledge that something might be living within him made Robert feel violated in a way he'd never experienced. How could this have happened? He asked as Dr. Okafor applied small bandages to the biopsy sites. I haven't traveled anywhere exotic. I've lived in Mapleton all my life. That's part of what makes your case interesting, she replied, labeling the samples carefully. Many parasitic infection are associated with travel or specific exposures. We'll need to build a detailed history of your activities over the past few months to identify potential sources. The next hour was spent answering countless questions. Had he eaten undercooked meat, swam in any lakes or rivers been around unusual, and pets traveled to rural areas, received any packages from overseas? Robert answered no to most questions, growing increasingly perplexed about how he could have contracted something so apparently unusual. What about your work before retirement? Dr. Okafor asked. Still taking notes. I was a postal worker, sorted mail, mostly any international mail. Robert considered this. Sure. Some packages from overseas came through our facility, but I never opened them or anything. Dr. Uffer made a note at your neighborhood. Any new neighbors who've moved from other countries, any exotic pets nearby. Frank across the street has a python. Robert offered had it for years, though, and Mrs. Diaz down the block moved here from Puerto Rico. Maybe 2 years ago. The questions continued until Dr. Okafor seemed satisfied she'd covered all possible vectors. I'm expediting these samples to our lab. We should have preliminary results within 48 hours. In the meantime, I'm prescribing an anti-parasitic medication as a precautionary measure. She handed Robert a prescription. This may cause some side effects: nausea, headache, possibly diarrhea if they become severe. Call the number on this card immediately. Robert stared at the prescription, reality beginning to sink in. This is really happening, isn't it? There's actually something living in me. Dr. Okafor's expression softened slightly. We don't know that with certainty yet, Mr. Bennett. But we're going to find out what's causing your symptoms and address it appropriately as Robert prepared to leave. Dr. Okafor added one more thing. I'd like you to keep a detailed log of any new bites or unusual sensations. Note the time, location on your body, and any other symptoms. This could help us identify patterns. The drive back to Stapleton felt longer than usual. Robert's mind replaying Dr. Okafor's words. Something moving beneath his skin. The thought made him shudder at the pharmacy. The technician who filled his prescription gave him an odd look after reviewing the medication, making Robert wonder if she knew what it was for. That night, Robert followed Dr. Okafor's instructions, setting up a notebook beside his bed to record any new symptoms. The anti-parasitic medication left him feeling nauseated, but he forced himself to take it as directed if something was indeed living within him. He wanted it gone. He considered setting up the camera again but decided against it. He wasn't sure he wanted to see whatever might be moving under his blankets in the middle of the night. Morning arrived after another restless night. Robert immediately examined himself in the bathroom mirror, counting 3 new welts, 1 on his lower back and 2 along his right thigh. He dutifully recorded them in the notebook, noting how they seemed to form a linear pattern almost like a trail. The thought made him gag. His phone rang as he was making coffee. It was Dr. Okafor calling much earlier than he'd expected. Mr. Bennett, good morning. I hope I didn't wake you. No, I've been up. Is everything okay? Robert detected urgency in her voice. The lab began processing your samples last night, and they found something unusual. I'd like you to come back to Cleveland today if possible, and I've asked a colleague to join our consultation, Dr. David Murray. He's a parasitologist with expertise in some rare conditions. Robert's hand tightened around the phone. You found something already. What is it? I'd prefer to discuss this in person. Mr. Bennett, Dr. Murray will be available this afternoon. Can you be here by 2? The second drive to Cleveland passed in a blur of anxiety and speculation. Robert's mind conjured increasingly disturbing possibilities, each worse than the last by the time he arrived. At the medical center, his shirt was damp with nervous sweat. Despite the cool October air, this time he was escorted directly to a conference room rather than an examination room. Dr. Okafor was already there, along with an older man with silver hair and wire-rimmed glasses whom Robert assumed was Dr. Murray. A laptop sat open on the table connected to a larger screen on the wall. "Mr. Bennett, thank you for coming back so quickly." Dr. Oker greeted him. "This is Dr. David Murray from the Centers for Disease Control Field Office in Cincinnati. He's consulted on similar cases and has particular expertise in parasitology." Dr. Murray shook Robert's hand firmly. "Mr. Bennett, I've reviewed your case file and the preliminary lab results. Quite remarkable, actually." Something in his tone made Robert's stomach tighten. Remarkable, good, or remarkable bad? The doctors exchanged glances before Dr. Ord gestured for Robert to take a seat. "We've identified what we believe is causing your symptoms. The tissue samples contained evidence of a parasitic nematode, a type of round worm, a worm." Robert felt lightheaded inside me. Dr. Murray took over, his manner clinical but not unkind. "Not just any worm, Mr. Bennett. Based on the molecular analysis and morphology, we believe we're dealing with Daria amidis, commonly known as heartworm." Robert blinked in confusion. "Heartworm, isn't that something dogs get precisely?" Dr. Murray nodded, turning to the laptop. "It primarily affects canines, but in rare cases it can infect humans. When it does, it behaves quite differently than in its normal host." He pulled up an image on the screen showing microscopic view of what looked like a translucent worm. "This is from your tissue sample. Normally these parasites mature in a dog's heart, hence the name. But in humans, they rarely reach the heart. Instead, they migrate through subcutaneous tissues just beneath the skin, or sometimes into the lungs." Dr. Okafor added, "The welts you've been experiencing are likely an immune response to the parasites movement. Your body is essentially trying to wall off these invaders as they travel through your tissues." Robert stared at the image on screen, a wave of disgust and horror washing over him. "How many are inside me?" Dr. Murray adjusted his glasses. "Based on the pattern and frequency of your symptoms, we suspect multiple immature worms perhaps introduced at the same time. What makes your case particularly unusual is the location. Ohio isn't typically associated with heartworm in humans. Most U.S. cases occur in southern coastal states. So how did I get them?" Robert asked, the surreal nature of the conversation beginning to hit him. "Heartworm is transmitted by mosquito bites." Dr. Murray explained. "The mosquito ingests microscopic larvae when biting an infected animal, usually a dog, and those larvae develop further inside the mosquito when it bites a human. The larva can be transmitted." Robert shook his head in disbelief. "I got this from a mosquito bite in Ohio. It's unusual but not impossible," Dr. Okafor said. "With changing climate patterns, we're seeing mosquito species expanding their territories, bringing diseases to regions where they weren't previously common." "The good news," Dr. Murray interjected, seeing Robert's growing distress, "is that we can treat this. The anti-parasitic medication Dr. Okafor prescribed is a good start, but we'd like to add another medication and possibly consider surgical removal of any larger nodules if they form." Robert barely heard the treatment plan as his mind struggled to process the reality. Dog heartworms were migrating through his body, creating trails beneath his skin as they moved. The very thought made his skin crawl. "Will I," his voice caught, "will I be able to feel them moving?" The momentary hesitation before "Do." Okafor answered, told Robert everything. He needed to know. Some patients report sensations of movement, particularly as the immune response intensifies, she said carefully. "But the medication should begin killing the parasites quickly." Robert looked back at the screen at the magnified image of the creature that had made his body its home. "I want them out," he said, his voice suddenly firm. "Whatever it takes, I want them gone." The Dr. D back to Mapleton PED in a fog of disbelief. Robert's hands gripped the steering wheel so tightly his knuckles turned white. His mind replaying Dr. Murray's words over and over. Heartworms, dog parasites moving beneath his skin. The very thought made every random sensation on his body suspect. Was that just his shirt collar brushing against his neck or something? Else he'd left Cleveland Medical Center with prescriptions for additional medications, a stronger anti-parasitic and anti-inflammatory too. Reduce swelling around the migration sites and a mild sedative to help him sleep. Dr. Okafor had scheduled another appointment in 3 days to assess how the treatment was working and to perform additional imaging. "You're lucky we caught this relatively early," she had said before he left. "Most cases are discovered only after the parasites have formed a significant nodule, usually in the lungs." Lucky wasn't exactly how Robert felt at home. He stood in his bathroom, pills arranged on the counter, staring. At his reflection, the man looking back seemed older somehow, his face drawn with worry lines that hadn't been there a month ago. Methodically, he swallowed each medication, then stripped down to examine his body more thoroughly than he ever had before. The most recent welts formed that disturbing linear P Dr. Okafor had noted, like a trail marking something's journey beneath his skin. Robert shuddered, fighting the urge to claw at his own flesh. Knowing what was causing the marks somehow made them more unbearable than when he thought they were simple bug bites. His phone rang, startling him. Rita's name flashed on the screen. "Bobby, what's going on? I called your house phone twice yesterday." Robert hesitated. He hadn't planned how to tell her, or if he should. The last thing he wanted was to discuss his own sister. "I've been in Cleveland," he said finally. "Medical tests." "Cleveland? Why didn't you tell me what's wrong?" The concern in her voice broke something in him. "They found out what's causing the bites. It's not bedbugs, Rita. It's worms. Her voice rose in pitch. "What do you mean, worms? Parasite the kind? Dogs get heartworms. They somehow got into me through a mosquito bite." Saying it out loud made it sound even more surreal. The silence on the other end stretched for several seconds. "I'm coming over," Rita said finally. "Have you eaten today?" "Rita, you don't need to. I'm coming over," she repeated firmly. "You shouldn't be alone right now." An hour later, Rita arrived with grocery bags and a determined EXP ration she'd stopped at Kroger's on the way over, buying enough food to last a week. As she unpacked in his kitchen, Robert explained everything the doctors had told him, watching her face for signs of revulsion instead. He saw only concern and a practical resolve that reminded him of their mother. "So these medications will kill them?" She asked, browning ground beef for the casserole. She was preparing, that's what they said, but Dr. Murray mentioned they might need to surgically remove some of them if they form nodules. Rita nodded, processing this information, and they're sure it came from a mosquito bite, not something at work or in your garden. That's the only way humans get them apparently infected. Mosquito bites an infected dog, then bites a person. Robert shook his head. "What are the odds? Do you remember getting bitten by mosquitoes recently?" Robert thought back. "I was sitting on the back porch most evenings in September. Got a few bites, then never thought much about it, and Frank's dog didn't. It died a few months ago, the golden retriever." Robert hadn't made that connection. "Caesar, yeah, back in August. Frank was pretty torn up about it, said it was heart problems." They exchanged a look of dawning realization. "You don't think I'm just saying?" Rita continued stirring the meat. If that dog had heartworms and mosquitoes bit it, then bit you." The possibility hung in the air between them. Robert remembered the summer evenings spent on his porch, Frank often in his yard next door with Caesar, both of them swatting at mosquitoes in the humid Ohio twilight. "I should tell the doctors about this," Robert said finally. "Might help them understand how it happened here in Ohio that night with Rita." Sleeping in the guest room down the hall, Robert felt less alone with his diagnosis. The sedative helped him drift off, despite his anxiety. Though his sleep was punctuated by vivid dreams of things crawling beneath his skin, morning brought a new development. As he got out of bed, Robert felt a sharp burning sensation near his right shoulder blade. Different from the usual itching twisting to look in the mirror, he spotted a raised ren area about the size of a quarter. "Rita," he called, his voice tight with alarm. She appeared in the doorway, still in her nightgown. "What is it? Something's different this spot." "It's not like the others." Rita examined his back, her expression shifting from concern to barely concealed alarm. "It looks inflamed, like something's really irritating that spot. It burns," Robert said, trying to reach it. "Not just itchy. It actually hurts. We should call the doctor." Rita insisted, already reaching for her phone. Dr. Okafor's office arranged for Robert to come in that afternoon instead of waiting for his scheduled appointment. The drive back to Cleveland felt interminable, the burning sensation intensifying with each passing hour. This time Dr. Murray joined Dr. Okafor from the start. They examined the inflamed area with grave expressions. "This appears to be what we call a migratory nodule," Dr. Murray explained, gently palpating the area. The calm. Parasite has likely settled temporarily in this location, causing an intensified immune response. Dr. Okafor took photographs and measurements. Is the medication causing this reaction? Possibly. Dr. Murray nodded. The antiparasitic could be killing the organism, which would trigger inflammation as your body processes the dead parasite. Alternatively, this could be the worm's reaction to the medication moving more aggressively or attempting to insist itself. Robert winced at both possibilities. What do we do now? I'd like to perform an ultrasound to get a better look at what's happening beneath the surface. Dr. Okafor replied, and we may need to consider removing this nodule surgically rather than waiting for the medications to work. The ultrasound revealed a disturbing image, a distinct elongated shape beneath Robert's skin surrounded by fluid from his body's inflammatory response. There it is, Dr. Murray said, quietly pointing to the screen about 3 centimeters in length. Based on the movement pattern and the ultrasound, I believe this is an immature adult female. Robert felt his stomach lurch. You can tell it's female. Females tend to grow larger and create more pronounced nodules. Murray explained clinically, they also provoke a stronger immune response. Dr. Okafor turned to Robert, her expression serious. Mr. Bennett, I recommend we remove this surgically. It's relatively close to the surface and excision would be straightforward. We could do it tomorrow morning. Tomorrow. Robert's voice cracked slightly. The sooner the better. Dr. Murray added, this nodule is causing significant inflammation, and there's risk of secondary infection. If we wait, the procedure itself is relatively minor. Local anesthesia, small incision removal of the nodule and surrounding tissue. Robert thought of the burning sensation that had only intensified throughout the day. The idea of something living inside him, something they could actually see on the screen, was unbearable. Do it, he said firmly. Tomorrow is fine. The details were arranged quickly. Robert would check in at 7:30 a.m. with the procedure scheduled for 9 more. Rita insisted on driving him and staying throughout that evening back at home. Robert called Frank Martinez. He needed to know if his suspicions about Caesar were correct. Frank, it's Robert from across the street. Rob, how are you? Haven't seen you around much lately. I've been dealing with some health issues, actually. Robert replied carefully. Frank, I hate to bring up something painful, but can I ask what happened to Caesar exactly? You mentioned heart problems. The line went quiet for a moment. Yeah, it was heartworms actually. Vet said I caught it too late. I still feel terrible about it. Why do you ask? Robert's suspicions were confirmed. I'm dealing with something unusual, and the doctors think it might be connected to mosquitoes that could have bitten Caesar. Then me, what? That doesn't make sense. Can humans even get heartworms? Rarely. But yes, I'm having surgery tomorrow to remove one. Frank's shock and remorse came through clearly in his voice. My God, Rob, I had no idea. Is there anything I can do? Just check your new dog regularly for heartworms. Robert advised and maybe warned the neighbors to use mosquito repellent next summer by morning. The nodule on Robert's back had grown more painful. The skin around it hot to the touch. Rita drove him to Cleveland in tense silence, neither wanting to voice their fears about what the surgery might reveal. The preoperative preparations passed in a blur of paperwork, vital sign checks, and repeated explanations of the procedure. By the time Robert was lying face down on the operating table, a surgical drape creating a sterile field around his upper back, he felt almost detached from the situation, as though it were happening to someone else. Were going to administer the local anesthetic. Now Dr. Okafor explained, you'll feel a pinch and burning sensation. Then numbness. Robert winced as the needle penetrated near the inflamed area, then felt the strange spreading sea-oldness. As the anesthetic took effect, a surgical resident positioned a small monitor, where Robert could see it if he turned his head, an ultrasound that would guide the extraction. We'll be making an incision approximately 2 centimeters long, Dr. Okafor narrated as she worked, then carefully dissecting down to the nodule. Robert felt pressure but no pain as the procedure began on the monitor. He could see the ultrasound image showing the worm-like shape surrounded by the fluid pocket his body had created. Fascinating. Case, he heard Dr. Murray murmur to someone else in the room. Rarely see Diomedes presenting this way. In this region, the extraction seemed to take both forever and no time at all. Robert felt increasing pressure as they worked deeper. Then a strange Sensation of release, got it. Dr. Okafor announced. Nodule is fully excised, Dr. Murray. Would you like to examine it before we send it to pathology? Robert turned his head to see Dr. Murray holding a small surgical container, peering at something inside with intense interest. Remarkable. Specimen, Dr. Murray commented definitely. Doroya emus female, as we suspected, approximately 3 cm and still mobile. Despite the medication, the phrase still mobile sent a wave of nausea through Robert. You mean it's still alive? He asked, his voice shaky. Dr. Murray looked up. Seeming to remember, Robert was awake and listening. Yes, though clearly affected by the anti-parasitic. This is actually quite valuable for our research, with your permission. Mr. Bennett, we'd like to send this specimen to the CDC laboratory for further study. The idea that his parasite might advance medical knowledge provided small comfort, as Dr. Okafor completed the procedure, placing several sutures to close the wound, and covering it with a sterile dressing. The good news, she told him as they finished, is that we've removed what appears to be the largest parasite. The medication should be effective against any remaining smaller ones in the recovery area. Rita sat beside him, trying to hide her distress behind a forced smile. How are you feeling? She asked, squeezing his hand like they just pulled a worm out of my back. Robert replied with grim humor. Did they tell you anything while I was in there? Rita nodded. Dr. Murray came out, briefly said they got it all, and it was what he expected. He seemed almost excited. Bobby said something about this being an important case for understanding how these parasites are spreading to new regions. Robert closed his eyes. Great. I'm a scientific curiosity, they also mentioned. They want to do some additional imaging, a chest CT scan, just to make sure there aren't any nodules in your lungs. This was new information. They're worried it spread to my lungs. Just being thorough. They said it's scheduled for tomorrow morning. The chest CT was performed early the next day. Robert Lee still as the machine hummed around him. Dr. Okafor reviewed the images immediately, then brought them to show Robert and Rita. Good news, she said, pointing to the clear lung fields on the screen. No evidence of pulmonary nodules. It appears the infection was limited to the subcutaneous tissues. Robert exhaled in relief. So the one you removed yesterday might have been the only one, possibly, Dr. Okafor replied cautiously. But based on your symptom pattern, I suspect there were multiple immature worms. The anti-parasitic medication should take care of any remaining ones before they grow large enough to form nodules. What happens to the dead ones? Rita asked. Do they just stay in there? The body will gradually absorb and eliminate them, Dr. Murray explained, having joined them to review the results. Essentially, your immune system will clean up the remains. The mental image was unsettling, but far better than the alternative of living parasites continuing to migrate through his tissues. We'd like you to continue the medication regimen for 4 more weeks, Dr. Okafor instructed, and we'll schedule follow-up appointments to monitor your progress. The sutures can come out in 10 days, as Robert, prepared to leave, Dr. Murray approached with an unexpected request. Mr. Bennett, your case represents a significant finding for our understanding of parasitic disease patterns in the Midwest. With your permission, we'd like to include it in a case study for the CDC and possibly medical journals. Your identity would remain confidential. Of course, Robert considered this. If it helps prevent someone else from going through this, then yes. Dr. Murray seemed genuinely pleased. Thank you. This could help raise awareness among physicians who might not consider parasitic infections like Durara in regions where they've historically been rare. On the drive home, Robert felt strangely lighter despite the surgical pain. Something tangible had been removed, not just a parasite, but the uncertainty that had plagued him for weeks. You know what the strangest part is, he said to Rita as they neared Maple all those nights. I thought I had bedbugs. I was right about something feeding on me after all. Rita grimaced. That's one way of looking at it personally. I'll never skip the mosquito repellent again. As they pulled into his driveway, Robert noticed Frank watching from across the street, concern evident even at a distance. There would be explanations needed, awkward conversations about parasites and transmission vectors. But for now, Robert was simply grateful to be home, with one less unwelcome guest living beneath his skin. Recovery proved more challenging than Robert had anticipated. The surgical site throbbed with dull pain, and changing the dressing required contortions he hadn't attempted in decades. Rita stayed for 3 days helping with the wound care before reluctantly returning to her own home and husband. I can come back every day to check on you, she insisted, Gathering her overnight bag, I'll be fine, Robert assured her, though untie lingered in his voice. The worst part is over, but he wasn't entirely convinced. Each unexpected sensation in his body triggered immediate alarm. Was it another parasite, moving just normal? Healing. His mind constantly replayed Dr. Murray's words about multiple immature worms potentially residing in his tissues a week after surgery. Mapleton Gossip Network had fully activated. Robert noticed neighbors watching from windows when he ventured onto his porch for fresh air. His phone rang. With concerned inquiries from former co-workers who'd heard something was wrong, the postal carrier even asked if he was doing better. Mentioning that Frank mentioned you were in the hospital. Mapleton had approximately 8,000 residents, but news traveled as though there were only 80. The most direct approach came from Gladys Weirson, the 73-year-old president of the neighborhood association, who appeared on his doorstep with a casserole and undisguised curiosity. Robert, we've been so worried, she announced, pressing the food into his hands. Is it true what they're saying about parasites from Frank's dog? Robert sighed, stepping aside to let her in, and there was no point denying it. Gladys would extract the information. One way or another, it's called diarrhea," he explained as she settled at his kitchen table. Dog heartworms transmitted by mosquitoes. Gladys, his hand flew to her mouth. Good heavens, in Mapleton? I thought those things only happened in tropical places. That's what I thought too, Robert said about making coffee, wincing as the movement pulled at his stitch, but apparently they're becoming more common in areas where they weren't before climate change, according to the doctors. How did they? Gladys hesitated. Clearly, both repulsed and fascinated. How did they treat it? Robert gave her the sanitized version medications. 1 surgical removal, ongoing treatment. He omitted the more disturbing details about feeling movement beneath his skin or seeing the extracted parasite still alive in the specimen container. Gladys peppered him with questions, each answered with increasing reluctance by the time she left. An hour later, Robert knew the entire neighborhood would have a play-by-play account of his medical odyssey. By dinner time, his prediction proved accurate that evening. His email inbox contained messages from 12 different neighbors offering everything from prayers to home remedies to articles about parasites they'd found online. Frank came by personally bearing a grocery bag of fresh fruit and crushing guilt. Rob, I can't tell you how sorry I am, he said, standing awkwardly in the living room. If I'd known Caesar's condition could somehow affect humans. You couldn't have known, Robert replied genuinely, not blaming his neighbor. The doctor said it's incredibly rare. They're writing a medical paper about my case. Frank looked stricken. That doesn't make me feel better. Is there anything I can do? Pay your medical bills. Drive you to appointments. Robert shook his head. Insurance is covering most of it, but there is one thing: make sure your new puppy gets regular heartworm preventative and spread the word to other dog owners. Frank nodded solemnly. Already done. I've told everyone. At the dog park, people are shocked. This happened here after Frank left. Robert sat alone on his couch, television playing unwatched in the background. The community's reaction, while overwhelming, provided an unexpected benefit, raising awareness about a disease people in Ohio typically dismissed as a Southern problem. 10 days post-surgery, Robert returned to Cleveland Medical Center to have his sutures removed. Dr. Okafor examined the healing incision with approval. Excellent progress, she noted, carefully removing the stitches. How have you been? Feeling overall? Any new symptoms? Nothing major. Robert replied, occasional itching in different spots, but not like before. The burning sensation is completely gone. Dr. Okafor nodded, making notes in his chart that's consistent with the medication taking effect. The antiparasitic should have killed any remaining immature worms by now. Your body will gradually reabsorb them over the next few weeks. The thought still made Robert queasy, but less so than before. What about long-term effects? Could there be eggs or larvae left behind that might activate later? Extremely unlikely. Dr. Okafor assured him. Unlike in dogs, diarrhea rarely completes its reproductive cycle. In humans, the female we removed showed no evidence of successful reproduction. You were essentially a dead-end host from the parasite's perspective. The term should have been comforting, but something about being called a dead-end host felt vaguely insulting. I've been reading some medical articles online. Robert admitted they mentioned pulmonary diarrhea causing permanent lung damage. In some cases, Dr. Okafor's expression softened with understanding. Your CT scan showed no pulmonary involvement, which is excellent news. The subcutaneous form you experience typically has no long-term effects once treated. But I understand your concern. This has been a traumatic experience, that's putting it mildly. Robert agreed. Every little itch makes me think they're back. That's a normal psychological response. She assured him, I'd like you to consider speaking with someone about that aspect. We have excellent counselors who work with patients after unusual medical events. Robert initially beaked at the suggestion of therapy, but Dr. Okafor was persuasive. This isn't just about parasites, Mr. Bennett. It's about regaining confidence in your body and reducing hypervigilance. Would you at least take the information he left with a referral to a psychologist specializing in medical trauma tucked into his wallet alongside his next appointment card? He doubted he'd call, but the option provided a strange comfort. 3 weeks after surgery, while deadheading Roz in his garden, Robert noticed a peculiar lump on his forearm near the elbow. Small, firm, and slightly red, his heart immediately raced as he examined it more closely. The Yao anti-parasitic medication should have killed any remaining worms, but what if one had survived? What if it was forming another nodule? He called Dr. Okafor's office, describing the discovery with barely contained anxiety. They scheduled an appointment for the following day, the receptionist assuring him that Dr. Okafor would examine it personally. That night, Robert barely slept, his mind conjuring images of parasites somehow surviving the medication, growing larger, multiplying by morning. He'd convinced himself the lump had grown, though in reality it remained unchanged. The waiting room at Cleveland Medical Center had become distressingly familiar. Robert found himself categorizing the other patients, wondering what invisible ailments brought them here, if any were as bizarre as his own. Dr. Okafor examined the lump carefully, her expression neutral. How long ago did you first notice this? Yesterday afternoon. Robert replied, tension evident in his voice. It wasn't there the day before. I'm certain. She palpated the area gently, then reached for an ultrasound probe. Let's take a closer look before jumping to conclusions. The small portable ultrasound machine displayed grainy images of the tissue beneath the lump. Dr. Oker studied it intently, moving the probe slightly to capture different angles. Mr. Bennett, she said finally, this is not a parasitic nodule. Relief washed over him. You're sure? Positive. This appears to be a small epidermal inclusion cyst, essentially a blocked pore that's formed a small benign growth. It's entirely unrelated to your previous condition. Robert stared at the lump, now transformed in his mind from a nightmare to a minor annoyance. So it's just a pimple, a bit more complex than that, but yes, essentially a blocked follicle that's become inflamed, common in adults your age. We can remove it if it bothers you, but it's completely benign. The diagnosis should have provided immediate relief. But Robert felt foolish for rushing to the doctor over something so mundane. I'm sorry for wasting your time. Dr. Okafor shook her head. You didn't waste anyone's time. Given your recent experience, your concern was perfectly reasonable. This is exactly why I suggested speaking with a counselor. The hypervigilance you're experiencing is a normal response to what you've been through. Robert nodded slowly. I've been checking my body obsessively, every little mark or sensation. I can't seem to stop. That's post-traumatic anxiety, she explained gently. Your body experienced something genuinely threatening and your mind is on high alert to prevent it from happening again. The counselor I recommended specializes in helping patients work through exactly this type of response. This time Robert took the suggestion more seriously. I'll call her. Dr. Okafor smiled. Good, and remember, you're still healing both physically and psychologically. Give yourself time. On his way out, Robert passed a display of CDC brochures in the waiting area. A new edition caught his eye. Emerging parasitic diseases in the Midwest, what you should know. His case had already begun impacting public health education. Dr. Patricia W. Baer, the psychologist Dr. Okafor had recommended, had an office in a converted Victorian home in Cleveland's suburban outskirts. The waiting room felt intentionally non-clinical. Comfortable furniture, soft lighting, no antiseptic smell. For that alone, Robert was grateful. Their first session began awkwardly. Robert, unsure how to explain his situation without sounding ridiculous. I had parasites. He started bluntly. Dog heartworms, transmitted by mosquitoes they were living beneath. My skin moving around one was surgically removed 3 weeks ago. If Dr. Weber was surprised she didn't show it. That sounds incredibly distressing. How are you coping with that experience? The question opened a floodgate. Robert described the initial misdiagnosis, the escalating symptoms, the horrifying revelation, and now the constant fear. Fear that somehow the parasites remained despite treatment. I drove 2 hours to see a doctor about a pimple. He admitted embarrassment coloring his words. I was convinced it was another worm. Dr. Weber nodded without judgment. Your brain is doing exactly what it evolved to do, protecting you from a threat you've already encountered. The problem is that it's now detecting threats where none exist. How do I make it stop? We retrain your brain to properly assess risk. She explained. This won't happen overnight, but with consistent work, you can develop a more calibrated response over the next hour. Dr. Weber outlined a treatment approach combining cognitive behavioral techniques and mindfulness practices, specifically designed for medical trauma. Robert left with homework, a journal to record trigger moments and his response, plus breathing exercises to manage acute anxiety. 2 days later, sitting on his back porch for the first time since his diagnosis, Robert found himself watching a mosquito land on the railing beside him. Previously, this would have sent him fleeing indoors today. He observed it with weary respect rather than panic. You caused quite a mess, he muttered to the insect before swatting it decisively. Rita called that evening, checking in as she did every other day. How was the psychologist? She asked, no judgment in her voice, surprisingly helpful. Robert admitted. She said, what I'm experiencing is normal for someone who's had a parasitic infection. Apparently it's similar to what people feel after food poisoning, hypervigilance about what they eat. That makes sense. When something invades your body, you'd naturally be on high alert afterward. She called it somatic. Hyper-awareness said, it will fade with time and some mental exercises. Speaking of awareness, Rita segued, did you see the newspaper today? There's an article about parasitic diseases spreading to new regions because of climate change. They mentioned your case not by name, but they referenced a recent human dirophilariasis case in central Ohio. Robert hadn't seen it already. That was fast. Apparently, the state health department issued an advisory to physicians to consider parasitic infections, even in areas where they weren't traditionally found. Your case is changing how doctors diagnose things around here. The knowledge provided unexpected satisfaction. His ordeal, as disturbing as it had been, might prevent someone else from weeks of misdiagnosis. At his 1-month follow-up appointment, Robert arrived at Cleveland Medical Center feeling markedly different than during previous visits. The crushing anxiety had diminished, replaced by cautious optimism. His vitals reflected the change: lower blood pressure, normal heart rate. Dr. Okafor reviewed his latest blood work with evident satisfaction. Your inflammatory markers have returned to normal ranges, which suggest your body is no longer fighting an active infection. Dr. Murray joined them, equally pleased with the results. Remarkable recovery. Mr. Bennett, how are you feeling? Overall better? Robert replied honestly, still checking for symptoms more than I probably should, but I'm working on that with Dr. Weber. Excellent. Dr. Murray nodded. I wanted to share something with you. The case report about your experience has been accepted for publication in the Journal of Emerging Infectious Diseases. Your experience will help educate physicians nationwide about considering parasitic diagnosis in non-endemic legions. Robert felt a strange mix of embarrassment and pride. Will they use my name? No, you'll remain anonymous, just a 62-year-old male from Ohio. But your case represents an important sentinel event in tracking how climate change is affecting disease patterns. Before leaving, Dr. Okafor provided Robert with a final prescription for anti-inflammatory medication and instructions to call immediately if any new symptoms appeared. Otherwise, I don't need to see you for 3 months, just a final check to ensure complete resolution. As Robert walked through the parking garage to his car, he realized this was the first time in nearly 2 months that he'd left a medical appointment without a follow-up scheduled for the immediate future. The constant cycle of tests, results, and treatments was finally breaking. Driving home along the interstate, farmers' fields stretching to the horizon on either side, Robert felt an unfamiliar sensation spreading through him, not the burning of inflammation or the crawling sensation of imagined movement, but something lighter, Not quite peace, not after what he'd experienced, but perhaps its precursor. The tentative return of normalcy in Mapleton life had largely returned to its regular rhythms. The neighborhood's fascination with his condition had faded as a water main break on Elm Street provided fresher gossip. Only Frank still routinely checked on him, their shared experience having forged an unexpected friendship. That evening, Robert sat on his porch watching the sunset paint the sky in orange and purple. A mosquito whined past his ear and he swatted it automatically. Without the spike of terror, such an encounter would have triggered a month ago progress he thought small steps back to normal. But he kept the insect repellent within reach, just in case some lessons once learned weren't easily forgotten as summer transitioned to autumn. Robert found himself settling into a new routine. His twice-weekly sessions with Dr. Weber had decreased to once every 2 weeks, and the constant checking of his skin had diminished to occasional inspections. The surgical scar on his back had faded to a pale line visible only if he contorted himself before the bathroom mirror, something he did less frequently now. October brought crisp temperatures and mercifully fewer mosquitoes. Robert's garden required final preparations for winter, and the physical activity provided a welcome distraction. While pruning his rose bushes, he spotted Frank across the street, raking leaves into neat piles. "Need a hand?" Robert called, surprising himself with the offer. Frank looked up equally, surprised. "Sure, if you're up for it." Soon they were working side by side, the repetitive motion of raking creating a comfortable rhythm. Frank's new puppy, a chocolate Labrador named Max, bounded through the piles, undoing their work with exuberant disregard. "He's on heartworm preventative." Frank mentioned, watching Robert's eyes track the dog. "Monthly pills, hasn't missed a dose. Vet says he's completely clear." Robert nodded, appreciating the reassurance without needing to ask for it. "Good too. Many people around here still think it's just a southern problem." "Not anymore," Frank replied, leaning on his rake. "Your case changed. That, did you see the notice the city sent out with the water bills all about mosquito control and heartworm awareness?" Robert hadn't seen it, having switched to automatic payments years ago. "They mentioned my case, not specifically, but it referenced recent human infections in the county." "That's you. Unless there are others we don't know about." The thought had never occurred to Robert that there might be others like him in the area suffering through the same confusion and eventual horrifying diagnosis. The possibility troubled him later that evening. Curiosity led him to search online for recent heartworm cases in Ohio. The results surprised him. 3 confirmed human cases in the state this year, including his own. All were in counties where the disease had rarely been documented. Before one news article quoted Dr. Diana Foster from the Ohio Department of Health. "We're seeing disease patterns shift northward with changing climate conditions. Parasites previously limited to southern regions are establishing themselves in the Midwest." Robert found himself reading everything he could find about diseases, medical journal articles, CDC reports, veterinary guidelines. Much of the technical information exceeded his understanding. But the broader picture became clear. What had happened to him wasn't as rare as his doctors had initially suggested, and it was becoming more common. The next morning, Robert called Dr. Okafor's office, recruiting to speak with her about this discovery. To his surprise, she called him back personally that afternoon. "Mr. Bennett, what can I help you with? I've been researching filariasis cases in Ohio." He explained, "There are others, aren't there?" "Not just me." Dr. Okafor paused briefly. "Yes, there have been additional cases documented this year. We didn't discuss this earlier because your focus needed to be on your own recovery, but these people, are they getting proper diagnosis, or are they going through what I did with everyone, thinking it's bed bugs or allergies?" "That's actually why the case report was so important," she replied. "It's raising awareness among physicians in the region to consider parasitic causes for unusual presentations." Robert considered this. "I want to help. Somehow these people shouldn't have to suffer for weeks without answers like I did." "I appreciate your sentiment," Dr. Okafor said carefully. "What did you have in mind?" "I'm not sure yet. Something to raise awareness, but first I'd like to understand more about what's happening. Why these cases are increasing. What's being done about it?" Dr. Okafor seemed to consider her response. "Dr. Murray is giving a presentation at the Cleveland Medical Center next week about emerging parasitic diseases in the Midwest. It's primarily for medical professionals, but it's open to the public. Would you be interested in attending? The thought of entering a room full of medical professionals was intimidating, but Robert's curiosity outweighed his hesitation. Yes, I would. The lecture hall at Cleveland Medical Center was nearly full when Robert arrived the following Thursday. He took a seat near the back, feeling conspicuously out of place among the white coats and scrubs that dominated the audience. A few rows ahead, he spotted Dr. Okafor, who acknowledged him with a subtle nod. Dr. David Murray took the podium precisely at 2 p.m., his presentation slides appearing on the large screen behind him. Emerging parasitic diseases. In non-endemic regions, climate change and public health implications read the title slide for the next hour. Robert listened with rapt attention as Dr. Murray detailed the changing patterns of various parasitic diseases across the United States. Heartworm was just one of several conditions expanding their geographic range due to warming temperatures, allowing mosquito vectors to survive in new regions. The case of Dirofilaria amidis in central Ohio represents a sentinel event, Dr. Murray explained, showing a slide with a map of documented cases. A red dot in Mapleton oxamate location marked Robert's case. What's particularly noteworthy is that initial misdiagnosis delayed proper treatment by nearly 4 weeks. A slide appeared showing microscopic images of the parasite extracted in from Robert's back, the very creature that had been living inside him. Seeing it displayed clinically divorced from the emotional trauma of his experience felt surreal. Early recognition is critical. Dr. Murray continued, physicians in previously unaffected regions must now include parasitic infections in their differential diagnosis. For unusual presentations, the patient in this case was fortunate that subcutaneous migration was the primary manifestation rather than pulmonary involvement. The presentation concluded with recommendations for health care providers, public health officials, and veterinarians to coordinate efforts in tracking and preventing these emerging threats during the question period. A young doctor in the front row raised her hand. Could the patient's initial symptoms have been recognized earlier? What signs were missed? Excellent question. Dr. Murray replied, the linear migration pattern of the welts should have prompted consideration of a mobile agent rather than static insect bites. Additionally, the lack of evidence despite thorough inspection for bed bugs should have triggered broader differential diagnosis. Earlier, Robert shifted uncomfortably in his seat, remembering those weeks of confusion and escalating anxiety. How different might his experience have been if the first doctor had recognized these patterns as the audience began to disperse? Following the presentation, Dr. Murray spotted Robert and approached him. Mr. Bennett, I'm glad you could attend. What did you think it was? Educational. Robert replied carefully. I had no idea there were so many similar cases happening across the Midwest. Dr. Murray nodded. It's an emerging pattern. We're monitoring closely. Your case has already helped several other patients receive faster diagnosis. That's why I'm here. Actually, I want to do more to help raise awareness. These people shouldn't have to go through what I did. Interest flickered. In Dr. Murray's eyes, what did you have in mind? I'm not sure yet, Robert admitted, but I'm a real person who experienced this, not just a red dot on a map or an anonymous case study. Maybe that could help somehow. Dr. Murray considered this thoughtfully. Actually, the Ohio Department of Health is developing educational materials about emerging disease threats. A first-hand account from a patient might be very compelling. I'd be willing to share my story, Robert said, surprising himself with his conviction. If it helps even one person get diagnosed faster. 2 weeks later, Robert found himself seated across from Dr. Diana Foster at the Ohio Department of Health offices in Columbus. The public health physician had contacted him after Dr. Murray mentioned his willingness to assist with educational efforts. Your experience puts a human face on what could otherwise seem like an abstract threat. Dr. Foster explained, recording their conversation. With Robert's permission, medical professionals respond to data, but the public responds to stories for the next hour. Robert recounted his ordeal in detail. The initial confusion, the frustration of misdiagnosis, the psychological impact of learning something was living beneath his skin, and the ongoing recovery process. The worst part wasn't the physical symptoms, he reflected, it was not knowing what was happening to me. Having professionals dismiss possibilities because that doesn't happen here in Ohio. Dr. Foster nodded solemnly. That geographic Bias in diagnosis is exactly what we're trying to address. Diseases don't respect state borders, especially as climate patterns shift by the end of the interview. They had outlined plans for Robert's testimony to be incorporated into both professional, education materials and public awareness campaigns. His identity would remain protected in clinical contexts, but for public education, he was willing to share his story openly. People need to know this is real, and it's happening here. He insisted. Driving home from Columbus, Robert felt a sense of purpose he hadn't experienced since retirement. His ordeal was transforming from a personal nightmare into something potentially beneficial for others. A metamorphosis that Dr. Weber had suggested might be crucial to his psychological recovery. November arrived with unexpected warmth temperatures. Reaching the mid-60s despite the changing leaves in Robert's backyard, a few confused roses attempted final blooms as he tended to them. The irony wasn't lost on him. The same climate changes extending the growing season had also expanded the range of disease-carrying mosquitoes. His phone rang, Dr. Okafor calling with results from his 3-month follow-up blood work. Everything looks normal. Mr. Bennett, she reported no evidence of ongoing infection or inflammation from a medical perspective. You've made a complete recovery, that's good news. Robert replied, though the psychological recovery remained a work in progress. Dr. Murray mentioned you're working with the Department of Health on their education initiative. I think that's commendable. Just trying to make something positive come from this experience, Robert said, deadheading a faded bloom. The first materials should be distributed to medical offices next month after ending the call. Robert noticed Frank watching him from the fence, line separating their properties, concern evident in his expression. Everything. Okay, saw you on the phone looking serious, all good? Robert assured him. Just getting a test. Results completely clear. Relief washed over Frank's features. That's great news, Rob. Listen, there's something I wanted to talk to you about. The county health department called me yesterday asking about Caesar and his heartworm diagnosis. Robert raised an eyebrow. They're tracking cases. Apparently they're creating some kind of map of canine heartworm cases to correlate with human exposures. Asked if I'd be willing to have Caesar's case included in their database. And I said yes, of course, but they also asked if you might be willing to participate in some kind of public forum next month. Something about community education regarding emerging health threats. Robert hadn't heard about this yet. Interesting timing. I was just telling Dr. Okafor about the education materials being distributed. Soon will you do it? Frank asked the forum thing. Robert considered the question. 6 months ago, he would have declined immediately, unwilling to discuss something so personal and disturbing in a public setting. But his perspective had shifted. Yes, he decided, I think I will. The Mapleton Community Center Gymnasium had been transformed with rows of folding chairs, informational posters, and a small stage area with a podium. Robert arrived 30 minutes before the scheduled start. Surprised to find the parking lot already filling with cars inside, Dr. Diana Foster greeted him warmly. Mr. Bennett, thank you for coming. We're expecting quite a turnout. Word has spread throughout the county. I'm a bit nervous, Robert admitted, eyeing the growing crowd. Never been much for public speaking. Just speak from your experience, Dr. Foster advised. That's what people need to hear after you share your story, Dr. Murray, and I will handle the technical questions by 700 p. Every seat was filled with additional attendees standing along the back wall. Robert recognized many faces from around Mapleton, neighbors, former colleagues, members of his church. Rita sat in the front row, offering an encouraging smile. Dr. Foster opened the forum with a brief overview of changing disease patterns in Ohio, then introduced Robert as a local resident who experienced firsthand the impact of these changes as he approached the podium. Robert's heart raced. He had prepared notes, but set them aside, deciding to speak directly from his experience. The room fell silent as he began. 6 months ago, I woke up with what I thought were bedbug bites. What followed was a nightmare. I couldn't have imagined one that eventually led to surgery to remove a dog heartworm that was living beneath my skin. A collective emmer rippled through the audience. I'm not sharing this to frighten anyone, he continued, his voice steadying. I'm sharing it because what happened to me doesn't have to happen to others. Early recognition and proper diagnosis can prevent weeks of suffering and uncertainty. For the next 15 minutes, Robert recounted his journey, the initial confusion, the escalating symptoms, the eventual diagnosis, and the treatment process. He described the psychological impact of knowing something was living inside him, and the ongoing process of regaining trust in his own body. The most important lesson I learned is that we can't assume certain diseases don't happen here anymore. Our world is changing, and threats once limited to distant regions are now in our own backyards, literally in my case. As he concluded, the audience responded with attentive silence, then respectful applause. Dr. Foster returned to the podium, thanking Robert for his courage in sharing such a personal experience. The technical presentation that followed felt almost anticlimactic after Robert's testimony. Dr. Murray presented maps showing the northward expansion of various mosquito-borne diseases, and Dr. Foster outlined preventative measures for both humans and pets during the question period. Most inquiries were directed to Robert rather than the medica,